Hello, people. How are you? Hope we are all fine. So the other day we had some discussion, some heated debate and discussion in one of the groups that I'm in, and the group actually it's a general group, but people are talking about family planning methods, and it seemed that most people in the group didn't differentiate one form of family planning method from the other one. And I promised them to do a rejoinder for the same. So I'm just doing this short audio, come video, just to to enlighten them on some of these family planning methods. And today, specifically, I want to talk about Depo Provera. So Depo Provera is a hormonal birth control method, actually, and it's injectable form of hormone progestin. You know, if you did biology, you would be knowing about progestin and estrogen. So this one has progestin, and it's administered every 3 months. If you convert it into weeks, it's every 11 to 12 weeks, I think. And actually, it's one of the highly effective contraceptive methods, and it works by preventing ovulation. That is, releasing the egg from the ovary every month, like it happens in normal cycles. And also, it weakens the cervical mucus to block the spermatozoa from going into the uterus to fertilize the ovum. So the cervix is just above the birth canal in a woman. So it works by thickening this mucus to form a plug and prevent the sperm from accessing the uterus and going to meet the ovary and the fallopian tubes for fertilization. And the third mechanism of action is by thinning the lining of the uterus itself, such that nothing will be able to, even if fertilization occurred at the fallopian tubes, then the embryo or the product of the fertilization will not be able to attach to the wall of the uterus, what we call the endometrium. Okay? So, but all these things, we'll talk about them, but then you should know that once you use this form of family planning, it's not a substitute for the barrier methods, for example, and it is not going to, it's only for pregnancy. It's only to prevent pregnancy, and it doesn't protect one from sexually transmitted infections like HIV, amongst others. So if you are also intending to prevent STIs, then you should also use barrier methods like condoms. Okay, so basically that's about it. So Depo Provera, some people will ask what medicine is inside. So it's a progesterone, like I said, and it's the name is usually medroxyprogesterone acetate. Okay, a type of progestin. And I've already enlisted the mechanism of action, and I said it is very effective, 99.8% effective. So it's more effective than oral pills. And of course, because it's injected into the body, you are not likely to forget. Like it's not like the pills that you are likely to forget to take, like if you are taking everyday pills. So once you inject, you have to wait until the next cycle and inject again. So no need to worry about you forgetting to take or to have it in your body. So like I said, every 3 months, so 11 to 15 weeks, sorry, I'd say 11 to 12 weeks. So, and it's usually administered by a healthcare provider. Mostly we are using the arms. You can apply on the arm, but also some healthcare providers usually apply it at the back, at the buttocks. So you have to have someone qualified, because we've had people having complications due to the injections, where someone injects into a nerve and someone will get some paralysis. So don't do it at home, even if you have it. You need it to be given by a qualified healthcare provider. Okay, and for maximum effectiveness of this injection, Depo Provera, it should be given within the first 5 days of your periods. So when you start having your period, within that, you count 1, 2, 3, 4, 5, you should give. And if, for example, you're giving it after delivery, which you call the postpartum period, then you have to consult with your doctor, whether you're breastfeeding or not, to know the specific time frame that you're supposed to inject or to start using Depo Provera after delivery. So many people also asked in the group there about the side effects, the possible side effects. And one of the most common side effects is irregular bleeding. So many women experience changes in their cycles, and they'll be having either spotting or more bleeding, or some people even have their periods disappearing when they start using Depo Provera. So this is an unexpected side effect. And the other one is your bones will become somehow weak, what you call decreased bone density. And this is because Depo Provera is a progestin. So you have more progestin in your body than estrogen. And estrogen is actually protective against things like osteoporosis or reduction in bone density. So once you have you are using the Depo Provera, especially after a long time, you might experience reduced bone density, and you are actually susceptible to fractures if you use it for a very long time, I think, not just a short courses or a few years. The other one that most people usually get also is weight gain, and this is because actually the progestin in it increases your appetite. So you are likely to eat more, and then you will become, you will gain weight. Of course, we have the other common side effects that they are, like from person to person, like headaches, acne, skin reactions, mood changes, and like I said, appetite also. And also, we'll talk about delayed return to fertility. Like if you take Depo Provera, it can take several months for fertility to return after you stop taking it. And the worst I've seen is 12 months. Yeah, so it goes from 6 to 10 months. So if you're looking for a family planning method that gives you instant reversibility once you stop taking it, so better go for other methods like the implants or IUCDs, or barrier methods, because once you take Depo and you want to get pregnant immediately after an injection cycle is finished, then you might not be able to get pregnant. Okay, so people also use Depo Provera for other reasons. You're using it for family planning, but also some other people use it to treat endometriosis. Endometriosis is whereby uterine tissue is found in other places other than the uterus itself, and this is usually a very stubborn thing, and it sometimes causes pain, excruciating pain. So sometimes Depo Provera can help, like to regulate these symptoms of endometriosis, and it's also protective against certain types of cancers like breast cancer, kidney cancer, and endometrial cancer. So these are just some side effects that are beneficial in addition to family planning. So, but all in all, I advise each and everyone who wants to, to start on these family planning methods, because I realized in that group, most of the people asking for them are either not married, they are not having any kids, they never got pregnant. So better to have a sit-up with your healthcare provider and discuss these issues and discuss, and have some tests done for you before you start any family planning method. That's my advice. So next time we shall talk about other methods of family planning. And if you're new here to this particular platform, I encourage you to follow us, subscribe, like the videos. You can share with your friends so that we can continue educating each other and sharing knowledge, because knowledge is power. Otherwise, till next time, thank you very much.